Now moving on to the next speaker, the name is Arnstein Mikkeltun. He is a professor of public health, and he is at the Norwegian Institute of Public Health in Bergen, and is a psychologist and epidemiologist. Over to you.
Well, thank you for this kind introduction, and thank you for the invitation to speak here at this conference. The topic which I'm asked to talk about is related to school dropout and mental disorder, and this is related to a project we're currently doing, where the main aim of the project is to disentangle whether this is a cause or an effect, or maybe both, and then moving on from there. There is also the attention to what might be the area of intervention. What would the intervention potential be here? And the starting point of this is the very well recognized dose-response association between educational level and mental disorder. And this is found repeatedly in epidemiological studies, so that the higher educational level achieved, the lower rate of mental disorder. This is now some years old publication we did based on the Hunt study. The Hunt study is a Norwegian epidemiological study, and this is simply the added risk of depression according to the educational level. We find similar associations prospectively, so that actually a cumulative educational level seems to be associated with reduced risk of mental disorder. And then we know already we've seen this from other presentations at this conference and previously, that first onset of mental disorder usually occurs in childhood or early life, and this obviously then invites the question whether mental disorder is the cause of poor educational attainment or maybe school dropout. There has also been reports of increased prevalence of common mental disorder during adolescence. So my background before starting this project is more related to occupational mental health, which is more related to older people. That is, from the age, say, 25, 30 up till 50, 60. That's the main focus. And I think this is an area which might actually have experiences which are highly relevant for school dropout. So I'll now actually just pause the issue of school dropout and mental disorder and give you a brief introduction to the occupational mental health field, and then get back to the school dropout area later on in the presentation. So in this occupational mental health field, there seem to be two competing paradigms, which both probably have some right, but they seem to disagree quite a lot. The first, which we might call the traditional perspective, is, we could call it a medical and an epidemiological perspective. It starts off with a mental disorder, and there's a lot of attention to how this is predicting later sickness absence and treatment, perhaps. And then the idea is that, after first there's the occurrence of the disorder, then comes the treatment, and then this again leads to cure and return to work. This is how we usually handle it. And it's also how the medical legal system is set up, actually. And we've done a lot of research according to this particular perspective. Here are just some few references. Generally, what we do is we start off with a health study, as you see on the left side here, where there's self-reported